Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. We have invited Dr. Frank Milnar, President and CEO of Milnar Mentoring, to be with us today. Frank, thanks for being with us.
Christian, always a pleasure, because the information you and I share is very relevant and very important, especially in this COVID crisis we have. So it's a pleasure always to be with you.
It is, and I think as people can look at the screen and see see the title right here, it's Minimally Invasive Dentistry is going to be the topic here. Why don't you go ahead and start us off?
Well, I always wasn't minimally invasive. Coming out of dental school in 1976, I was destructive dentistry. Everything we did was destructive. We gouged out teeth for silver fillings, we undercut them, and then we didn't know what was going to happen as a result of that. Teeth would break. But we didn't know. We were taught to do it. And in dental school, if we didn't take enough tooth structure away, we got a bad grade. So what do you think we did and learned coming out of dental school?
Destroy.
Deeper and bigger is better.
Yeah.
Okay? We were droids. We were on an assembly line of massive destruction. We didn't know what was going to happen to that. We didn't, but we felt good. We felt good when we could do a MOD buccal lingual with 4 reinforcement pins screwed into the teeth. We thought that was Miller time afterwards, okay? We had no idea what we were doing that way. And now we're seeing the ramifications. So the younger dentists out there, when you get dentistry from 30, 40 years ago, you're going to look at that and say, what were these guys thinking? Well, we were thinking we were taught to do this, so we kept on doing it. Okay? Now, for you young dentists out there, listen up. This is where you want to get your pen and your paper out and write this. Everything you do in life and to a tooth has a consequence, short-term or long-term. You get to decide which one it is, because it really determines the survival rate of the survival of the tooth. Do you think that's pretty important? Oh yeah.
Yeah.
Now, less is better. In my world, more was better. Bigger was better. And then we would crown these teeth, and we would put gold crowns back in the 70s, and we were really on top of our game. And then porcelain to metal came around, the white crowns, and they were big and bulky. We didn't care, because we were great construction workers, destroying and putting things back together. We had no goal. We didn't understand risk. Minimally invasive today, Christian, this is a big educational opportunity. If we query 100 dentists in the Twin Cities and say, describe to me in 100 words or less what is minimally invasive, see what we get. We're not going to get good content. Minimally invasive today is the primary prevention of dental disease and destruction. It's the science of intercepting, detecting, diagnosing, and treating dental disease on the microscopic level. That is not a handpiece. Okay, that is diagnosing physician-like. Are you high blood pressure? Do you have high cholesterol? Did it run in your family? We're diagnosing on making the invisible visible. This is minimally invasive today. The time to diagnose risk before you start. With minimum damage to the tooth, all you have to know is engineering and have the right materials. The focus is on conservation of enamel. Take away enamel in a cavalier sense because it's convenient for your handpiece, your burr, or your matrices. Don't do it. You lost your best friend. designs with engineering principles is to conserve enamel and eliminate the need for macro mechanical retention. Don't gouge out the tooth. Shame on you. And if the tooth has a white spot lesion that's been demineralized, heal it. Make the invisible visible and use something, a remineralization material, and then heal it so you can use it in the restorative sequence. Christian, the thing they didn't tell you in organic chemistry and the thing they didn't tell you in biomaterials and physiology in dental school, it's pH. pH is the driver of a lot of disease processes known as dental decay, because in the flora of the mouth, there's hundreds of species of bacteria. Most of them are good neighbors. They're good community. They survive in a buffered atmosphere of neutral pH or slightly alkaline. 3% of the microorganisms are the criminals. These are the bad guys. The lactobacillus, the strep mutans, these are the acid-producing bacteria. If you feed them, they destroy. They can take over. Like a virus, they can take over things, the communities, the neighborhoods. They can shut down the good buffering bacteria, and then they can cause rapid destruction. You have to know what the pH of your patient is in the resting saliva, because if they have acidic saliva, you're feeding right into the perfect storm. And if you take that tooth apart and put your work in a bad ecosystem, your work is not going to last. Think about this. You replace a crown that was done 2 years ago and now it's got decay. Oh, Christian, let's replace the cavity or the crown. What happened? Was it poor work? Was it a bad environment? Don't you think you might want to step out in front and test that first and qualify it? Excuse me, Christian, that doesn't make sense to me. It lasted 2 years. Mind if I do something? Can I just check the pH of your saliva? I want to see what I'm building into as a builder.
Okay.
Christian, you have acidic saliva. No wonder that didn't work. Looks like a decent crown, but I'm not going to touch that and replace it. My work will last 2 years as well. Let's see what we can do to diagnose and treat to get this into a suitable environment before we rebuild again. If the mouth is, you're going down, the tooth is going down, your work's going down. Do you think you might get a bad review on social media? Oh yeah, you're gonna go right on the list.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team.
I'm Frank Milnar, a dentist for 43 years. I'm the president and CEO for Milnar Mentoring, designed to make you more competent and confident with your clinical dentistry by receiving personalized mentoring, which reduces your procedure time and increases your profitability. I look forward to working with you in the future. We want to know what happened. When did you get your first cavity? If you're females, there's 3 break points: puberty, pregnancy, and menopause, where the saliva can become acidic, and you want to step out in front and be part of that. Okay? If all of a sudden they said, Doc, my teeth got soft when I got pregnant, besides eating 10 pounds of chocolate, but then you say, I'll bet you your saliva changed and you got acidic saliva. So we're going to diagnose and check that and make sure all the baseline information is good. We want to be proactive and be differential diagnosticians like a physician. We want to know. Just ask Christian, is this the first time this crown has been placed? Is it been, can I ask you a question? When was that crown done? oh, the doc who did it was rough. I didn't think they did a good job. Yeah, maybe it's an open margin. Maybe you got to do something better. But gee, he was a good dentist. I changed because my insurance changed. He did a nice job, but I don't understand why it lasted 3 years or 4 years. What do you think? I'm going to check your saliva to make sure it's not sick and acidic, because otherwise what I do will make it worse. I'll just drill more of your tooth away underneath, and then it gets deeper and worse at that point. Be proactive. Talk about risk assessment. This is different. This is minimally invasive dentistry, is the art of diagnosis, not the art of treatment. It's the art of diagnosis, Christian.
Mm-hmm.
What am I saying? Minimally invasive is listening. Minimally invasive is take a step back, don't pick up the handpiece. What kind of ecosystem are you building in? Are you dealing in a compromised acidic ecosystem? Don't do it. You're better off not doing anything and let an unsuspecting dentist walk right into the quicksand of acidic saliva. That's minimally invasive. Now, if you pass the first test, Christian, now you go to the next step, and that's preparation guidelines. And which materials are you can you put into a modified opening that's small without getting air voids and all that. That's a minimally invasive dentist, knowing which, do you heat up the composite like I do in the flowables? Are you injecting with no air bubbles in? Do you know how to prep the tooth with engineered radius bevels to distribute the force so you don't have a hole that can't distribute stress? You want a modified engineered preparation with the right heated materials to distribute the stress like a shock absorber in a good ecosystem that's going to last 20, 30 years. End of story.
So Frank, for a patient, minimally invasive means what? Because you can say that to a patient and they'll just look at you like, I have no idea what that means.
It's a lost leader, Christian. It's like a cosmetic dentist.
Okay.
You got to be real careful and qualify it. If you think you're minimally invasive, you better talk the talk and walk the walk, and talk to a patient that you think has a compromised platform, and you see a lot of interproximal cavities on the x-rays, to say, can we call a timeout here?
Mm-hmm.
I'm curious why this is happening. We need to slow this down and find out what's going on and how to step out in front of this, because I care about your tooth. I know I care about what's going to happen to your tooth, and I care about you. Redo odontics is not minimally invasive.
Okay, so then for patients, I mean, you know, I've talked to patients, I know you have too, where it's, the doc wanted to crown every tooth in my mouth. And it's like, and they run from doctors like, or from dentists like that. And I mean, and so this minimally invasive piece may, tie into that.
Well, it does, because I get the consults, and I'm not playing good cop, bad cop. These are my brothers and sisters of dentistry, and I
Correct.
represent the flag and mantle of dentistry. I will never badmouth another person.
Mm-hmm.
All I can do is educate and say, I don't want to know which teeth were crowned. I don't even want to see what was recommended. Let me look with my own eyes. And what would I come up if it was me, or you're my sister or my friend? This is what you're going to get from me. I don't take what they say is wrong and right and everything, but I look at these with fresh eyes, with a new prism of minimally invasive. And when I see somebody trying to harvest a crown on something that should have just had a re-engineered restoration, I just shake my head and say, that tooth will never recover. This is irreversible. This is a destructive dentist that's going to do harm and destroy. The survival rate of these teeth, and especially in young people, it's questionable. Those teeth can't make it. They can't.
Mm-hmm.
You do a deep filling, then it turns into a root canal, and then the tooth breaks off at the gum, and you put a post in, then you put a crown in, and the root breaks, and then you have to take the tooth out, graft the socket, here comes the implant. You could have saved all that time and money by doing minimally invasive engineered restorations that are guided in purpose. And what else can I say? That's a minimally invasive dentist.
Okay. Frank, thank you very much. That was great. That was great information. That was really great in highlighting some of those tips. And thank you very much for being on the show today. I appreciate it.
My pleasure, Christian. It's always a pleasure working with you and for the audience.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white and see you next time on the Dental Breakdown Show.